Hello everyone. So today we are going to discuss case number 222 of medicine. A 35-year-old woman presents with weight gain, proximal muscle weakness, and purple stria. Her serum cortisol is elevated and does not suppress with low dose dexamethasone but suppresses with high dose dexamethasone. What is the most likely diagnosis? Alpha adrenal adenoma, beta Cushing disease, Charlie ectopic ACTH production, or delta exogenous steroid use? I am going to give you 5 seconds so you can answer this question by yourself. Yes, the answer is B, Cushing disease. Let's discuss why this is the answer. Our answer is B, Cushing disease, because as we all know, the patient is presenting with a complaint of Cushing syndrome. And after that, we have to do a low dose dexamethasone test that will tell us what is the etiological factor of this syndrome. And in this case, we are seeing that the patient has no suppression with the low dose dexamethasone, but the suppression with high dose dexamethasone. This is indicating that the patient has a pituitary ACTH producing adenoma. This is also called as Cushing disease. So, this test is telling us what is the etiological factor. The etiological factor is an adenoma in the pituitary that is producing ACTH, which is causing the increased production of cortisols from adrenal gland, and this is also called as Cushing disease. Okay, Cushing syndrome is simply the increased amount of cortisol, and Cushing disease is one of its etiological factor, that is an adenoma in the pituitary gland that is producing ACTH, which act on the adrenal gland, which produce the cortisol. Okay, so let's discuss why not the other options are correct. Option A was exogenous steroid. Steroid are equal to cortisol in simple language. So when we are giving the exogenous steroid, that means our body is having high cortisol level, high steroid level. The patient has the same, maybe if the dose is very high, the patient present with the same symptom just like Cushing syndrome, but it is due to exogenous steroid use. And when we do the test, the ACTH is suppressed in these patients. ACTH is why ACTH is suppressed, because our pituitary is assessing that the cortisol is high. No further ACTH is required because ACTH cause the cortisol to release from the adrenal gland. Already cortisol is high normally, then the ACTH is suppressed and the cortisol is high, but the dexamethasone test has no effect on this level. Okay. Number two, B option was ectopic ACTH. In this condition, the cortisol stay high despite the both low dose and high dose dexamethasone. Why this is happening? Because ACTH is producing from an other site. It could be different site. That one I will give you example like carcinoma, oat cell carcinoma of lung, or any other ectopic site from where the cell are producing ACTH. Okay, and our D option was adrenal adenoma, like directly in the adrenal gland which is producing cortisol. It is independent of the influence of ACTH. So ACTH is suppressed because pituitary is working normally. The cortisol autonomous and the no and that is not suppressed by the dexamethasone. Okay, the gland itself is working by its own, no control of ACTH because ACTH coming from the pituitary. Okay, the adrenal gland has adenoma and that is producing directly the cortisol, and the dexamethasone test has no effect on it. Okay, and let's discuss some other notes that will help you in the further MCQ. Moon face, buffalo hump, and stria. These are the clinical feature of Cushing syndromes. Okay, so these are Cushing features. And then the question could be investigation of choice for Cushing syndrome, and that is the our MCQ is also giving our this test name, low dose dexamethasone suppression test. Okay, uh, First of all, we have to do the low dose dexamethasone suppression test, which is the investigation of test in this disease, in this syndrome. Then we also do a high dose dexamethasone suppression test. So remember that high dose dexamethasone suppression test is used for differentiating the etiological factor of the Cushing syndrome, not uh, investigation of choice for the Cushing syndrome. When we do low dose dexamethasone suppression test, if the cortisol is high, this confirm our disease, the Cushing syndrome is there. Then we have to differentiate why Cushing syndrome is there. Is it due to adenoma of adrenal gland? Is it due to the pituitary adenoma or the ectopic? Then we do high dose dexamethasone test. Okay. If ACTH is high, cortisol is high, and that is suppressed with the high dose, this is the pituitary adenoma, this is the Cushing disease, and this is our case. Okay. If no suppression at all, whether we do low dose dexamethasone or the high dose, this is the ectopic ACTH or the adrenal tumor. It could be ectopic ACTH. I told you, oat cell carcinoma of chest. Okay, and here and the last point is, if we see no mass in the adrenal gland, like the adrenal tumor is there, we see the mass. If no mass is there, but the ACTH is still high, then we suspect the ectopic ACTH producing site. And what is the most common ectopic ACTH producing site? I told you this is the oat cell carcinoma of the lung. Then we do chest CT. Okay, the next investigation could be chest CT. We have to rule out the carcinoma of the lung. Lastly, I'm going to give you algorithm for dexamethasone suppression test for quick review and hitting your MCQs correctly in the exam. Dexamethasone is a cortisol that we give normally. Normally, when we give the external cortisol, external dexamethasone, what will happen? If we firstly we give low dose dexamethasone, normally what will happen? The cortisol of the body should decrease. If it should decrease, then this is the normal presentation. The patient is normal. If by giving the low dose dexamethasone the patient is still has high cortisol, then this confirm our diagnosis of which disease? Cushing syndrome. Then we proceed to the high dose dexamethasone. What we see, if we give the high dose dexamethasone and the cortisol decrease by giving the high dose dexamethasone, we suspect a pituitary adenoma that is producing ACTH, and that disease is called as Cushing disease, which is our case. If by giving the high dose dexamethasone, the cortisol is still high, then we have two suspicion. Either it is a ectopic ACTH or this is the exact tumor of the gland that is producing the cortisol. Okay, the adrenal gland. So for differentiating this, we have to check the ACTH. If the ACTH is low, this is adrenal Cushing, yeah, the adrenal adenoma. If the ACTH is high, then this is the ectopic ACTH. We have to rule out first of all the lungs. First of all, we have to check the lung carcinoma or cell carcinoma of the lung. Okay. Then further we have to check the other areas where the tumor is present that is producing the ACTH. That's all for this video. Thank you so much for your attention. I hope this video will help you in the solving MCQs. Please like and subscribe to our channel Sword of Knowledge.